Hi, it's Olivia with Seeds of Healing Orthopedic and Integrative Manual Therapies, and I have a volunteer here today who has some knee pain when she plays tennis. And so we're going to work on some of that pain that she's having. Now, we did some assessment tests before the video, and she has a little bit of pain in her ACL, and she has a little bit of pain back here in the hamstrings with her knee. So one of the first things that I kind of want to point out that I hope I can get on video here is when we look at her foot, we see that this foot angles out at about 45 to 50 degrees, and we really want to bring that to zero. So what's going on here is we have the femur and muscles that are tight in the femur pulling one way and the tibia pulling another, which creates an imbalance within the knee where it's not neutral. So first what we're going to do is work all the quad muscles and the IT muscle, the IT band and all the muscles that attach to that, and start working, bringing neutrality to the knee. And of course, I'm not completely prepared because this is my first video. So the quads are responsible for hip flexion and for knee extension. And what we want to do is we want to bring these muscles back to a neutral state. So they're probably a little tight from working out and playing tennis, right? Mm-hmm. Are we a little tender here at all?
Not bad.
Not
They're
bad?
tight, I can tell them.
They're tight. So right now we're just doing a little bit of myofascial release within the tissue. So that way it's a little bit more malleable to work and loosen it up. Now as you see, I'm working from the knee to the hip. So that's lengthening that muscle back out. Whereas in most massage, you'll see things kind of go very, very different. So we're warming up all this tissue so we can create length. Now let me know if anything's, too intense. We don't want anything painful, okay? So right now we're working the main quad muscle, rectus femoris, which turns into the patella tendon. So the rectus femoris runs underneath the patella, and that tendon turns into the patellar tendon. And so tightness in that main quad muscle can cause pain like under the kneecap. It also can contribute to some of the clicking that Jenny's feeling in her knee when she bends and extends it. So all about creating neutrality. All right, doing all right?
I feel it.
You feel it. Now, I'm getting a little bit of trouble getting Jenny's quad to release entirely in a quick manner, so we're going to do a little bit of cheating today. And I like to use my silicone massage cups when we're short on time and maybe a little much too pain going on, getting a little bit faster release in that fascial tissue within the muscles. So Jenny, what I'd like you to do is just pretend you're riding a bicycle with that leg. So what we're doing is a pin and stretch on the rectus femoris muscle here. So I've got the muscle kind of pinned down in place, and as she extends and flexes her legs, it gives it a little bit of a stretch. How's that feeling?
I feel it.
And she can feel it. And go ahead and relax for me. And go ahead and extend that leg out. Now let me know if that reduced any of that tenderness for you.
Mm-hmm.
And it reduced that tenderness really quick. So that's a very easy way to get a stretch on your client, or even at home after playing tennis, when everything's a little sore. This is one of my favorite things to do for self-care, is using the cups at home. Now also, because we're trying to create a neutral space and she has a positive reaction here on the ACL, we need to treat this IT band. Now the IT band itself isn't mobile. It's a little bit stuck. We can feel that. It's probably a little bit tender too by the touch. Well, that IT band actually comes from the TFL muscle here on the outside hip and the lateral glutes that do internal and external rotations. So instead of pushing on that IT band, we're actually going to cup it and allow movement to happen. It can get a little bit intense, so just let me know and we'll back off, okay? And so we're just pulling the fascial tissue up off the IT band so we can create movement. How's that doing?
Better than a roller.
Well, so since you brought up rolling, here's some interesting facts about the IT band and why you should never roll it. So fascia is, when you look at a chicken breast, it's that white tissue layer that you see when the skin's off. So that's fascia, and we have fascia throughout our whole body. It's like this huge web. Well, the IT band, it takes 22,000 pounds of pressure to snap it. It's like having a steel rod in the side of your leg. So if you continue to push on it and push on it and push on it, like with rollers, all we do over time is create more binding and less movement, which means more flare-ups on the knee, more flare-ups on hips. So I highly recommend people to not roll the IT band and just use cups. Now we found a nice tight spot right there. All right, so now we actually want to address some of the muscles that are attached to that IT band as well. And this TFL is responsible for internal rotation of that femur. So as Jenny rotates her thigh in, go ahead and rotate your foot towards that way, I can actually feel that muscle pop into my hand. And she can feel that as well. So go ahead and relax for me, Jenny. And we're just going to loosen up these muscles that are a portion of that IT band. Okay, Jenny, let me know, is there still tenderness right here?
No.
That tenderness is all gone. Because we've opened up that IT to where it can move freely. Wonderful. That was really quick and easy. So now what we're going to address is the pain that she was feeling in her quads and this rotation of her foot so we can create a neutral space for the knee for it to stop clicking. Okay. So let's go ahead and have you roll over for me, but we'll have your face down here. Very important to remember which side I'm working on. So Jenny was having a little bit of discomfort on testing. Wait, that one. See, that's why I bring it up. On testing Jenny, she was having a little bit of discomfort here on the lower quad and up here, correct?
Right in the back of the knee.
So go ahead and bring that foot up for me. So come on up, nice and hard against my resistance. And go ahead and point to where you're feeling that for me. So she's feeling that right there, right where the popliteal muscle is in the back of that knee. So what we're going to do is first get all these muscles back into neutral and then work that injured point. So again, doing some myofascial release, getting everything warmed up. Now we do cross fiber gliding to get deeper into that tissue and really make sure we bring those muscles to a more neutral state. Okay, Jen, so now what I want to do is test again, and I want you to point where you're feeling that. Okay, go ahead and give me resistance. And give me a little bit more. And where are you feeling that right now? Right up in here. Okay, well notice that once we got a neutral state for the majority of those hamstrings, that pain there in the fold of the knee went away. Can you go ahead and scoot that way a little bit? That way. Perfect. All right, so the pain in the middle of the knee went away, and now we've just got some pain up here in the higher portion. So again, we'll just open these muscles back up. Get a release there. All right, and let's test that again, Jen. Are we feeling anything?
No, that's good.
And let's bring it up further and test a little more now.
Good.
Feeling good? Great thing with Jen is she didn't have any tears. If she had had any tears, we would have treated that in more detail. But now what we're going to address is creating that neutral space. So we want to bring this 50-degree turn back into at least a 0 to 10 degrees is acceptable, and see if we can rid Jen of that clicking of the knee. So we want to get a little higher up here and focus on what's called the biceps femoris on the back of the thigh, getting that loose and opened up so we can bring this tibia back into place and hopefully create a neutral space for the knee. Let's do a quick check. So now we've got her about 15 degrees, which is great progress. We'll do a couple more. And we have her about 7 degrees, which is perfectly acceptable. So Jen, I want you to go ahead and stand up for me over here and let me know how you're feeling. Just go ahead and do some squats, or let me get you on video. There we go. And test things out. How's your knee feeling? Good.
I feel a total difference between the left and right.
Okay, and then how about some clicking if you want to just test out that one side?
It's still there, but
It's still there?
It's not as pronounced.
Not as pronounced. Okay, great. So the next portion that you guys will see after this is Jenny doing exercises.